Thank you, and it's my pleasure to be with you here. It's nice to see the room full. What we've done since London is just a lot of work again with this exciting project. We had the results from the consensus conference, which we had in London, and then we left with these number of statements, and we had to clear them and tidy them up and draft the online survey, which you basically took part, most of you in it. But the main thing about this exciting project, we wanted to be relevant to your practice. There are many, many consensus conferences and position statement you see, and they just go and sit on the shelf in somebody's office. We want this to touch your practice, to touch your work and make an influence to what you do. So that's why we made it quite personal to your work. So the survey basically, it came on behalf of the AAS and SAGES. We send it out at the end of March, and we ask you 2 questions about each statement. Do you agree with our recommendation, yes or no? And the second important one, what is the likelihood of this statement will change impact of your practice? And actually, that was quite an important aspect for this project. Interestingly, we had over 750 responses from the 2 societies, which is the survey is still open till now, which is telling us that we chose the right topic, and we hopefully and continue to choose topics that are of interest to you and definitely can help you. So what we've done is analyze the results. We only analyzed over about 650 because we had to draw a line to come to prepare for today. And then there was quite an agreement on a lot of the statements, which is very nice to see. But there were about 20 statements. There were overall together about 80. 20 statements, they were either disagreeing, the members, with our statement itself, they are disagreeing with our recommendation, or vast majority of them, they are disagreeing with the likelihood to impact in practice. And that is the aim of this session today, ladies and gentlemen, is to take this further and vote on each of these things. We will be presenting to you all the evidence on these controversial issues. We, in fact, will be presenting to you all the evidence from the survey, but we will focus and vote on these controversial statements as you will see in the session. So we will go systematically, as Pat mentioned. We'll go from topic 1 to topic 6. Topic 1, we did not create any recommendations because that's pure epidemiology. So there are a level of evidence which will be presented to you. From level 2 to level 6, there will be recommendations. We will state and describe to you the recommendations from the survey. The ones with an agreement, we will go through it straight away without evidence. The ones with controversial statements or disagreeing with the recommendations, we will go through the evidence and then we'll ask you to vote again. And as Pat mentioned, how are you going to vote again? The voting is quite important. Before I go to the voting instruction, let me clarify one thing for you. Sometimes we have low level of evidence, but we have a strong recommendation. And that is based on the last statement of this slide. It's about the balance. It's about the balance between the desirable effect of our statement and the value and perform to our practice. So remember, it's not just related to the level of evidence. So we could have a weak recommendation, but a weak level of evidence, but strong recommendation, or vice versa. It depends on the balance between desirable and undesirable effects. So you will see this page. When we go through and we will announce, each speaker, they will say, this statement will have a revote. And then we'll pause. Then you will see this slide. You will have the option. You either go through the website of pollav.com, and then you basically vote, or if you text each one, you will have a number, okay? This is the code for yes, this is the code for no. So you can just simply text that code, and that will come to us as your response that you are agreeing with our statement. And the second one, exactly the same for about changing your practice. And every time we will make sure to be clear about this instruction. Once we receive enough number and or the time is expired for this voting, we'll move into the second vote. Is that all right? Right. Now, I think we're pretty much all excited And I am looking forward, actually, to seeing the first speaker to come in and present to us the evidence on level 1. Thank you.